Portions of the following program may be pre-recorded.
Living Healthy and Aging Well. We are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park, located here in Eden Prairie, Minnesota. I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us anytime at 612-999-3426. We look forward to hearing from you. And once again, that number is 612-999-3426. In fact, one of the folks that called recently said, you got to give out that number more often. I keep forgetting to write it down. So we'll do that throughout the show today. Now, we are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our shows on the AM 950 radio website, and we can also be found on Apple iTunes, Spotify, SoundCloud, and many other podcast and streaming services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. All right, we have another great show for you today. Joining me in a few minutes will be Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. Now, Harvey is a licensed agent in life, health insurance for all ages, accident and travel insurance in the state of Minnesota. Harvey's also certified with 10 Medicare insurance carriers. We will be talking about planning ahead for Medicare in advance of age 65, also discussing ABCs of Medicare and how it's constructed. And of course, the most important thing is the importance of participating in an insurance coverage review during the annual Medicare enrollment period. That starts October 15th through December 7th every year for current Medicare beneficiaries. And so the clients of Harvey's get the benefit of talking to him throughout the year and discussing what's going on with their particular situation. So, as all of you know, Medicare is a complex system with a lot of moving parts and a foreign language to many. Having someone who can advocate for you to make certain that your doctors and medications are obtained from in-network providers helps keep your expenses as low as possible. Cost and cash flow matters, and health insurance agents aim to help you protect your cash flow. Health insurance should not be left up to chance. You don't want to wing it. Throwing a dart and hoping for the best plan can be risky. Responding to a flyer in the mail, taking advice from a famous sports star or celebrity on TV, or some other marketing effort is not finding someone who is looking after you. Yes, health insurance should be all about you. It takes a little bit of planning and strategizing, and that's where Harvey Pearl and Pearl & Company provides concierge-level service to guide you through the process. As Harvey tells us, you don't know what you don't know. So you'll enjoy hearing my conversation today with Harvey. He is one of my favorite guests because he's so enthusiastic and passionate about what he does. All right. Before we begin our conversation with Harvey, I want to mention our new website has been launched. You can find us at livinghealthyagingwell.com. There you can find information about upcoming guests as well as listen to my previous interviews. That's Living Healthy Aging Well. I want to thank Julie Hamilton and her team at Avalo Web Development for their amazing work on our website. Thank you, Julie. Also, we received several calls about a previous show we had with Joel Denny. He's the executive director and owner of Care Builders at Home of Minneapolis. We talked about the many services that Joel and his team provide to aging seniors in the Twin Cities. Care Builders at Home recently launched its wellness program, which allows seniors to connect to caregivers and family members virtually through their existing televisions. This technology is easy to use and is accessible to seniors who may not be comfortable with cell phones and computers, but are used to operating their TVs. For more information, visit carebuildersathomemn.com. Once again, carebuildersathomemn.com, or just give Joel Denny a call at 612-260-2205. Also, I want to mention that if you're looking for assisted living in the St. Paul area, look no further than Episcopal Homes. They are located near Highway 280 and University Avenue, and they have been serving older adults for over 125 years. Part of a continuum of care, their assisted living community offers studio, 1- and 2-bedroom apartments, and the services there are provided by a compassionate care team who get to know you and what you like and become like a second family. Stay as busy as you want. You can attend art classes, exercise classes, singing groups, prayer groups, worship services, enjoy fine dining, take in live performances, see a movie at the theater, gather with friends at the bistro or pub, take walks through gardens, head over and read to children from the on-site daycare. Episcopal Home Living also offers memory care with specialized activities and support for those impacted by memory loss. For more information, visit episcopalhomes.org or call them at 651-632-8801. And I would encourage you to stop over there. The campus is amazing. They have several buildings that do several different services for our seniors, and they've been doing it for a long time. All right, folks, you have 2 ways to get your questions answered today. First, you can ask your question live on the air by calling AM 950 radio station, and our friendly show producer, David, will take your call and get you on the air. The number to reach us to get your question on the air is 952-946-6205. Once again, 952-946-6205, or you can directly text me your question at 612-999-3426. And please do not wait until the show's ended to call. Ask us your questions now on the air when we're here. And I've got Harvey sitting right here. If you call me after the show, I don't get a chance to get a hold of Harvey right away. So many times we have the same questions that are asked after the show ends. So please give us a call during the show today. All right, I want to welcome my guest today, Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. And Harvey is a licensed agent, and he covers all kinds of insurance. But we're going to focus today on Medicare because it's Medicare open enrollment period. Right, Harvey?
'Tis the season.
That's right. All right. We got a couple minutes left in the first segment. Give us just a little background about you. The audience loves to hear, even though they may have heard you last month when we talked about this. There's a lot of new listeners, so give us a quick background about Harvey Pearl.
Well, one of the things that makes me a bit unique is that I used to own and operate a nursing home a number of years ago on the East Coast. And where that has been useful information is because I've been through the experiences of dealing with people who have physical challenges and medical challenges and governmental processes and all of that fun stuff. But it really does allow for some unique insight. And I'm finding that a lot of those experiences that I had years ago come to play. And people seem to appreciate when I get to incorporate those references into our conversations. So that's one of the things that we bring to the table. And like I said, 'tis the season, Ken. We're in the heat of it. December 7th comes up soon. It's a hard stop. The federal government has made that clear. This is the date that any updates and reviews for existing Medicare clients. So, and that's the thing to distinguish. If you're newly enrolling into Medicare, you don't have the December 7th deadline. It's for existing Medicare clients to get their reviews done, make sure that they're in the most current, relevant, appropriate plans. And it can be surprising from year to year because one medication can change and totally change your plan and totally change your dollars. So if you're not planning for that, you're not prepared for that, it can be a real eye-opener in January when you go to the pharmacy and pick up that medication and it costs what? So we want to avoid those surprises.
Yeah. Well, we're going to talk more about that because there's different components to Medicare coverage.
Totally.
And so we're going to get into some of that here during the show. But if you have a question, listen, this is a complicated area. You just need to give us a call. We got the expert here sitting in the studio. It's time for a short break, folks. We'll be right back and continue our conversation with Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency, and we're talking about the annual Medicare open enrollment period that ends December 7th. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. You are listening to Living Healthy and Aging Well. I'm Ken Haglund. We'll be right back.
Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage available. You deserve an advocate you can trust and coverage you can rely on. And there's no fee, ever. Annual enrollment is October 15th through December 7th. Call me now at 651-303-8889 so we can strategize together.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Hi, Matt McNeil here. The last year and a half has been tough, so thanks to everyone who became a member of AM 950. You've helped keep progressive radio in Minnesota. Last year, as a thank you, we put out a calendar, and my goodness, was that popular. Well, we've done it again. The AM 950 calendars are back for 2022. This year's calendar has more of my photos taken in the great city, county, and state parks of Minnesota, plus important dates in both progressive and AM 950 history. All new or current members who make recurring donations of at least $25 will be thanked with a calendar, or with a one-time $50 donation, we'll gift you a calendar as a thank you. In addition, if you make a donation, either a one-time or recurring, you can write a 1 to 2 sentence personal message that will be read on the air by myself, Matt McNeil, over the holidays. It's really simple to become a member of AM 950. Go to our webpage, am950radio.com, click on the membership button, and sign up. Make a recurring donation of at least $25 or a one-time donation of $50, and we'll send you the gift of a 2022 AM 950 calendar. Thank you so much for supporting AM 950, the progressive voice of Minnesota.
Ask me that later.
All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Haglund, and joining me today is Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. And we are talking about the annual Medicare enrollment period that is currently going on, and it ends December 7th. If you have any questions for us, and I've got the expert here in the studio about Medicare, please call us at 952-946-6205 or text us at 612-999-3426. Okay. Before we return to our conversation with Harvey, I want to mention this program is brought to you each week by Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with innovative and comprehensive end-of-life health care. The team at Minnesota Hospice has been helping patients and family members with award-winning end-of-life healthcare services. Please do not wait to learn how hospice care can benefit you and your loved ones. Hospice brings compassionate medical, social, emotional, and spiritual services to your home with no cost to you or your family. If you have any questions regarding end-of-life care or support, please contact the caring team of experts at Minnesota Hospice. Don't wait. They are available 24 hours a day, 7 days a week. There is a licensed registered nurse standing by to answer your questions. Their phone number is 952-898-1022. Once again, that number is 952-898-1022, or visit them online at minnesotahospice.com. Okay, Harvey, now let's make sure people know how to get a hold of you and get more information from your fabulous website.
Thank you. Phone number is 651-303-8889. Again, 651-303-8889. And our website is pearlsofwisdom.com, and that's PERLES of wisdom.com.
And it's a great website, a lot of information, and I know we want to talk about education this segment. Let's jump into that, because that's what it's all about.
We
that's
focus
what you
a lot on that. Actually, we use the expression we don't know what we don't know, and it's so true. And when we don't know things, it leads to stomach acids, and stomach acids get churned up, and then we have fears because we don't know, and therefore we're afraid of addressing certain things. And so with education, it's really very laid back. We want to empower our clients with knowledge. We want to help them understand how Medicare is constructed so that we can then figure out how to make it apply to you as an individual. And consistently, we find that at the end of a conversation, our clients frequently say, I feel much better than I did an hour ago. And that's wonderful. And that's exactly what we want.
And you're not a doctor.
No, not even close. No. But I know who to call if I need one.
That's right.
But the point is to make us all feel comfortable about this. We really want to strengthen our knowledge. So what we offer are some educational webinars on our website, pearlsofwisdom.com. In the Education tab, we're offering on November 28th a Simplifying Medicare session. It'll be about 60 to 90 minutes. We're offering it at 10:30 in the morning, at 1 in the and 1 in the afternoon. You can come to both if you wish. These are free. They will be Zoom webinars. Easy to sign up. You get an instant notice to confirm your place. And some wonderful questions come out of it. So we go through kind of basic reviews, and then people start asking things that apply to them. And we address those issues that are appropriate for a group of people in one room, in these Zoom rooms. We are general about that. And then when it gets into something that's really specific and really applies to individuals, then we'll save that for a separate conversation. But without that knowledge, how can you expect to make good decisions? And that's one of the things that really concerns me about when we look at these ads that are coming in the mail and that we see them on TV. They're all very important because they raise the level of importance of this period. Mm-hmm. That's good. But we lack the individualization. The person who answers the phone does not know you. And when you work with an agent who knows you, who knows your history, who knows just all about you, then we're able to address specific things. A client called me and said, I just heard an ad and this company offers great dental coverage, so I signed up for it because I spent too much money on dental this year. And so I said, well, that's great. Are your doctors in network? Well, I don't know. Well, did they ask you? Well, no, they didn't ask me that. And I said, what about your medications? No, they didn't ask me about my medications. They said, how do you know that plan's really good for you? The item that is isolated for advertising purposes is great and certainly caught your attention, very effective, but they got to know the full picture of all of what makes up you. And so, we hear about Part B givebacks, of Part B premiums being credited back. It's a very attractive feature, but it doesn't apply to everybody. Mm-hmm. So you can't gear around one or two issues. You really have to look at the whole picture. And frequently we're finding that when we break down the parts, people realize that it's okay to let all of that noise go, and let's focus on what works for them. And part of the joy of all of this is that as we get to know you over the years, we're here all year round. You pick up the phone and say, okay, life just happened. What do I do now? That's what we're here for. We don't have voicemail. We only have human beings answer my phones. I will only have humans answer my phones 24/7. And the joy of that is you're actually being heard, and you don't have to guess, is someone going to call me back? When are they going to call me back? You get that from a voicemail. We don't have voicemail. And so it's a very, very human approach. And so my administrative manager, Rafael Quintero, is as much as responsive as I am. We're involved with people, and we want them to know that we're available to them.
One of the questions, since you were on in September and October as we were gearing up for this educational campaign, so to speak, here with the Medicare open enrollment period. A couple of the texts that I got, one gal said, I was just diagnosed with cancer this summer. Right. And she said, what do I need to do with Medicare? And so we can talk about that maybe in the next segment here. But when you say I'm available all year round for things happen to people all year round. They don't just happen in the few weeks between October and December.
That's right.
And it's important to be planning for those things because certainly in my practice we see people with all kinds of things, and everyone is different. Every one of our patients is different, and they need different things. And so, one size does not fit all.
Absolutely not. And one of the things that we remind people, and somewhat jokingly, but very seriously, it is rare that we die of good health. And so we have to plan for it. It's like, why do we buy fire insurance for the house? I haven't had a fire in 35 years. Why do I still need this? Because the day you have a fire, boy, are you going to be relieved you have insurance. Right. Client called me this week, just wonderfully healthy. I want to be this person as I get older. Absolutely wonderfully healthy. But and so we planned for a plan that if he gets sick, and he said, why do I still need this? He got diagnosed with AFib this week. And then he was reminded, oh, yeah, that's what I planned for. Right. And that's what we want to help people think about what's going on in the future.
All right. It's time for a short break, folks. We will be right back to continue our conversation with Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency, and we are talking about the annual Medicare open enrollment that ends December 7th. If you have any questions for Harvey, please give us a call, 952-946-6205, or you can text us at 612-999-3426. You are listening to Living Healthy and Aging Well. I'm Ken Hageland. We'll be right back.
Don't be surprised if you hear your name when you walk into St. Paul Corner Drug. Our experienced staff make getting to know you their top priority. Developing a trusting relationship with our patients is the first step in providing personalized care that achieves the best outcomes possible. Make certain all your providers know who you are and what your needs are. It is a vital step in your well-being. Stop by St. Paul Corner Drug today to start a relationship with a staff that cares. St. Paul Corner Drug, pharmacy the way it should be.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Hi, this is Laura. AM 950, the progressive voice of Minnesota, is home to some of the best political talk in the Twin Cities. Okay, the best political talk. It's been a crazy time. We endured 4 years of a self-described extremely stable genius who said Mexico was going to pay for the wall. He never paid off Stormy Daniels, and it was ridiculous to suggest he asked another country's leader to do him a favor. Unfortunately, the COVID virus was not a Democratic hoax. Inequity is real. America needs solutions to our climate crisis. AM 950 is one of the very few independent progressive radio stations in the United States. Thanks to AM 950 listeners and our partners, we've stayed in business for 17 years. Go to AM 950 Radio and see all the great independent businesses advertising with us. If you have a business or know of a business that could benefit from reaching the passionate listeners that support the advertisers on this station, send me an email, Laura@am950radio.com. That's Laura@am950radio.com.
Fine dining, walking paths, gardens, and green space, the sound of children playing, groups gathered to sing and paint, prayer groups and water aerobics classes. Those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments. Services to help you get through your day are provided by a compassionate care team who get to know you, what you like, and your routines, just like a second family. Stay as busy as you like attending art or exercise classes, take in live performances or a movie at the theater, gather with friends at the bistro or pub, head outside and read to the children from the on-site child care. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Part of a continuum of care, Episcopal Homes has proudly been serving older adults for over 125 years. Check out episcopalhomes.org for more information.
With your AM 950 weather, I am David Lyon. Saturday, partly sunny with a high near 41. Saturday night, partly cloudy with a low around 27. Reserve your fresh turkey today at Ferndale Market, raising range-free turkeys without shortcuts since 1939. For more information, go to ferndalemarkets.com.
AM 950 KTNF, St. Louis Park, Minneapolis, St. Paul.
All right, folks, welcome back. You are listening to Living Healthy and Aging Well, where we talk about ways to improve your health and quality of life. My name is Ken Haglund, and joining me today is Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency, and we are talking about the annual Medicare open enrollment period that ends December 7th, and what are the things you need to know in making a good decision, a good choice that you live with for the next year. If you have any questions for Harvey, please give us a call, 952-946-6205, or text us at 612-999-3426. Okay, before we return to our conversation with Harvey, I want to mention and remind you that if you or your loved ones are interested in exceptional care services, be sure to contact Episcopal Homes, located in St. Paul, Minnesota. Episcopal Homes is proud to provide a full range of senior living and home health care services, and these range from transitional care and short-term rehabilitation to innovative long-term care, assisted living, memory care assisted living, home care services for campus residents. There's also neighbor care, which is in-home support for people that are not on the Episcopal Homes campus. Also, independent living services, affordable senior housing, along with intergenerational child care. To be a part of this continuum of care, Episcopal Homes has been proudly serving older adults for 125 years. For more information, visit episcopalhomes.org or call them at 651-632-8801. All right, Harvey, quickly, let's make sure people know what number they need to call you at if they have any questions after the show is done.
Okay, terrific. 651-303-8889. Never hesitate to call. 651-303-8889, or catch us on our website, pearlsofwisdom.com, P-E-R-L-E-S of wisdom.com.
All right. And it's a great website. Very well done, and it's very easy to read, folks. All right. We do have a caller on the line, Dan from St. Paul.
Hello, can you hear me?
Yes, you're coming in loud and clear, Dan. Go ahead with your question.
Thank you. Harvey, I have a question. I recently turned 65 several weeks ago, and I registered for Medicare. And unfortunately, I've run into a financial situation where I cannot afford to make the premium payments. can I unregister, or am I forced to get on to Medicare when I turn 65?
Well, Dan, first of all, thank you for calling and happy birthday.
Thank you.
Welcome to the club of the world of Medicare. You raised some very realistic issues, and we work with these situations often. You're not alone. I would not unenroll from Medicare. What we can look at together are options. There are programs that help offset certain costs that you have to apply for and register for and qualify for. But we can find programs with you to help offset those costs, because one of the key things here is to make sure that the cost of Medicare is digestible. We've got to make this work in your cash flow, and we got to take out that stress, because we don't want to increase undue injury just because of stress over Medicare coverage. So my recommendation is, with your particular situation, if we can talk offline, please feel free to give me a call and we can get more of the details that apply to you. And absolutely, we've got connections and resources of people that we work with here in the Twin Cities area to help find solutions. So you raise a really good point. Thank you. Thank you for bringing that up.
Thank you. And I will call you. I'll call you on Monday then.
If you want to wait till Monday, that's fine. Today's fine. Tomorrow's fine.
Oh, okay. All right.
It's annual enrollment period. We're always working.
No, that's
Dan.
right. Harvey's doing full time, 24 hours a day, 7 days a week until December 7th. So feel free.
Okay.
Honest to goodness, the show ends at 1:00, so you could probably give him a call shortly after 1:00. And Dan, do you have his phone number?
No, I do not.
If I haven't drilled it in enough, here we go. 651-303-8889. And one more time. 651-303-8889.
Thank you, sir. I will call you today.
Looking forward to speaking with you.
All right,
Thank you again
Dan.
for calling.
Hey, thank you. Thank you for listening to the
Bye.
show, Dan. We appreciate it. All right, take care. All right, so there are so many issues. It's not just choosing the plan. It's how do you finance the plan? How do you pay for the plan?
Absolutely.
It goes so far beyond. That's why people cannot listen to a 30-second commercial and think they know what they need to do.
Right.
It's almost dangerous to make decisions off of a card you get in the mail or somebody talking on the TV for 30 seconds.
You're absolutely right. And you know what? Good for them for being such effective marketers that I don't want to say manipulate people, but it obviously does cause a reaction. And what I try to encourage people is you own your own space. You get to listen what influences you, and then you get to make your own decisions. So that can bring up questions. A given ad can bring up questions, but then you need to research further. And we're basically offering ourselves to be a resource for you to get those kinds of answers.
Right.
So with regard to Dan's question, we're lucky. Here in Minnesota, we're absolutely it is amazing the resources that we have available. We have Minnesota Care. We have Minnesota Medical Assistance. We have other groups and agencies that have incredibly creative ways to find ways to afford health care going forward. The Social Security system has what is called the Extra Help system, and that offsets the cost of prescription drugs. And, of course, we have to apply for these things and see if we qualify for them. And if we don't qualify for them, then let's come up with another solution. We have worked with people in helping them make sure that they get adequate food financing to, it's getting their health care coverage, and then we look at Maslow's hierarchy of needs, food, shelter, and those necessities, and we want to make sure that you're okay. And so it really is kind of a broader picture thing. And so Dan's question is so apropos, and I really appreciate that he called me.
Well, I remember on a previous show with you, you talked about the fact that you have a great network of people, resources that go beyond the insurance area. You've got people, as you just spoke about, there's a lot of areas. And one of the reasons we started this show years ago was that we found that people just didn't know where to turn.
Right.
I mean, they weren't even aware that there were options out there. And as you always say, you don't know what you don't know.
Right.
We're trying to help people to know that there are things. And just talk to people like yourself who are passionate, and this is your life's work. go to people like you.
You know, one of the famous expressions I've used over the years is, I don't need to know all the answers. I just need to know who knows all the answers.
That's right.
And so you build your network and you build your connections. And we're very fortunate. We've got some very willing people, willing individuals who are also passionate about their work. Mm-hmm. And we form some wonderful working relationships, and we work together, and our clients, receive the results of that.
Right,
it's really wonderful.
Right. And one of the things that to point out to Dan is that your services, as extensive and as amazing as they are, don't cost anything.
Good point. Yes, there is no fee ever. And certainly if you hear our ads, we underscore that there's no fee ever. Yes, we do earn a commission it's a big if you purchase a policy through our agency. Obviously, we want to earn your trust and earn your business, but you're not obligated to buy a plan through our agency. But there is no fee at all, and that's what makes us that much more accessible throughout the year. You don't have to worry about, is this going to cost me if I pick up the phone? Don't worry about it. Pick up the phone. But the other thing that's really important is for people to know that we are not incentivized from one carrier or one plan to another to lean someone in a direction. We're here to be objective. We are objective advocates, if only by our licensure. Mm-hmm. We have to be objective advocates for you. And so that's where the no fee ever concept comes across. Mm-hmm. And it really is important to give people that much more comfort and willingness to pick up the phone and call. We like people. Mm-hmm. We enjoy talking with them. I just want to touch base on one more thing before we end in this block. You know, we talk about education. I want to leave a nugget with our listeners today. People might have heard of an HSA, a health savings account, which is available if you have a high deductible health insurance plan. Sometimes that's through an employer, or sometimes that's available individually. Mm-hmm. But if you have a health savings account, that is a vehicle that offers triple tax-free benefits. So they're tax deductible with the contributions that go in. They can be invested and they can grow tax-free. And when they're pulled out for medical or prescription costs, they come out tax-free. And the reason why this is an important vehicle to be aware of is because there is a rule that says 6 months before your Part A Medicare goes into effect, you need to stop contributing to your HSA. And it's a really important rule because if you don't follow the rule, there's a penalty. Like everything in life, there's a penalty. And so we strategize with our clients in making sure we're picking the right effective dates to try to reduce or eliminate any penalties. But I say if to those who are listening today, tell your kids, tell them now, start an HSA if they can. It is worth building. We have clients who have $50,000 in their HSAs and growing. These are funds that you can use throughout life, even in your Medicare years. You can't contribute in your Medicare years, but you can use the funds. And so this is really an important thing. And we say how to prepare for Medicare in your 30s. This is a good example of how one can prepare for that. And we don't think about that because in our 30s we're invincible and we're never going to have those problems and those issues. This is good strategy time now. Mm-hmm. So we really encourage people think ahead for those types of opportunities and ask us, and we'll share with you what we know.
And so the HSA, when a person's retired and they're on Medicare, that can be used to pay for expenses, costs associated with their health care. It can't be used to pay for premiums, though. Good point. So yes and no. Okay. Because there's always two perspectives on this. So technically speaking, HSA funds are not supposed to be used to pay premiums. However, if your Part B premium is deducted from your Social Security check, you can reimburse yourself the Part B premium that is reduced. But you can't pay the premium to Social Security. So there's the yes and no to it. So Medicare is filled with contradictions. And thank you, federal government, for creating all of these because it gives us what to do during the day. We really appreciate it. But these are the things that we want to help you know about them so we avoid pitfalls. Yeah. Well, and we've had health care provided to us throughout our working lives and never really had to spend a lot of time learning about it.
Right.
It was given to us or provided to us. And now all of a sudden, for the last 30 years of your life, you got to become an expert.
Right. This is not
work with an expert.
Of course. Well, this is not a course in high school. We don't learn
That's
this
right.
then. So.
All right, folks, it's time for a short break. We will continue our conversation with Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. If you have a question for Harvey, give us a call, 952-946-6205, or text us at 612-999-3426. You are listening to Living Healthy and Aging Well. I'm Ken Hagelin. We'll be right back.
Now, more than ever, we are being faced daily with the topic of human mortality, and for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost-effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage available. You deserve an advocate you can trust and coverage you can rely on. And there's no fee, ever. Annual enrollment is October 15th through December 7th. Find me at pearlsofwisdom.com. That's PERLES of wisdom.com. So we can strategize together.
Fine dining, walking paths, gardens, and green space, the sound of children playing, groups gathered to sing and paint, prayer groups and water aerobics classes. Those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments. Services to help you get through your day are provided by a compassionate care team who get to know you, what you like, and your routines, just like a second family. Stay as busy as you like attending art or exercise classes, take in live performances or a movie at the theater, gather with friends at the bistro or pub, head outside and read to the children from the on-site child care. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Part of a continuum of care, Episcopal Homes has proudly been serving older adults for over 125 years. Check out episcopalhomes.org for more information.
Taking prescription medication should not be a scary task. The staff at St. Paul Corner Drug makes certain you know everything about your prescription medication before you leave the pharmacy. Knowing what to expect and when and how to take your prescriptions gives you the confidence to safely take your medication and maintain good health. Should additional questions arise, we are here to help sort things out. St. Paul Corner Drug, pharmacy the way it should be, at stpaulcornerdrug.com.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide.
Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about ways to improve your health and quality of life. My name is Ken Hagelin, and joining me today is Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency, and we've been talking about the annual Medicare open enrollment period that ends December 7th. So this is the last segment, folks. If you have any questions for Harvey, we got the expert in the house today. Please give us a call, 952-946-6205, or text us your question at 612-999-3426. Harvey, let's let people know how they can get a hold of you if they have any questions that we're not addressing here on the show today.
Thank you for asking. Yes, our phone number is 651-303-8889. Again, that's 651-303-8889. And our website is pearlsofwisdom.com, spelled P-E-R-L-E-S of wisdom.com.
All right, folks, and we will give that information out one more time before the end of the show in about 6 minutes here. But if you have any questions, give us a call. This is the last time we'll have Harvey on before the open enrollment period ends December 7th. And as he mentioned earlier, don't wait till Monday to call him. I'm throwing you out there, Harvey.
We're here for you.
Yeah. No, and again, a live person answers the phone, so you'll get connected right away. All right. Let's talk about the DIYers. and tell me about the famous phrase you came up here with, DIYers.
And
what does DIY mean?
For the do-it-yourselfers, the DIYs out there, and there's a lot of DIYs out there. And for those people who see these ads and want to call the person of the moment that they get on the phone, that's great. And that's why those options are available. Those people like to feel they are in control. They can handle this. That's great. And then there's other people that need hands held. They need some guidance. They need, take me through this process. I need to know I've got someone I can rely on. We're hand holders. And we're really comfortable with that, and it's really, really important. I saw a billboard a number of years ago that said, when DIY becomes OMG, you got a problem. And so we want to prevent the OMGs from happening. And it's not a reflection on your abilities. It's not a value judgment. But if you want your hand held and you want someone you can bounce off of and just say, okay, I'm willing to admit what I don't know. That's okay. Let's grow together and let's learn from each other. And that will be, that's what we're here to do.
And you take classes every year, you to get licensed.
We have to get certified every year
right.
in the plans and in the carriers in which we represent to make sure that we're current on all of the information and all the plan details.
Right.
So this is a very licensure-heavy industry that we are in.
But you're learning too. I mean,
constantly.
So someone who's not involved in that, to think they can come up with the perfect decision every year without people like you is again risky. At best.
Right. The rules do change. And one example of that is that in the prescriptions that you have, in the plan that you're in 1 year, one of your prescriptions may be accepted, and in the next year, that prescription is dropped by the carrier.
Right.
But we don't know that unless we do a review.
Do the research. Okay.
Right.
We have another call here. We have Kathleen from St. Paul calling in. Hi, Kathleen. Oh, we may have missed her.
Kathleen, call back.
Yes, give us a quick call back. We'll get that question answered for you. Let's continue talking about, Harvey, the reason why it's important to get a hold of someone like yourself.
Well, and one of the things that people discover in our conversations is that contrary to a traditional health insurance plan that you've had in life, there are no family plans in Medicare. Everything is individualized. Right. So in a spousal couple, it is not uncommon for people to be on two totally different plans because each of their medications are different, each of their medical histories are different, each of their doctor choices are different. And so that's okay. We want to maintain that individuality and make sure that you're both on a plan that works.
All right. Yeah, keep
One of the
here.
other things that is important to mention to people is that in the world of Medicare Advantage plans, when you move from county to county within a state, that could change the coverage that you have available. So if you're moving from county to county in Minnesota, you may need to have your Medicare Advantage plan reviewed.
All right.
But in a Medigap plan, you can move county to county, state to state. Doesn't matter. It goes with you.
That's right. Location can make a big difference here.
Big difference, yes.
Well, we got Kathleen back on the line
Yay!
here from St. Paul. Kathleen, can you hear us?
Yes, I can.
All right. What is your question for Harvey?
Well, hi, Harvey. I've just recently started to hear about such a thing as Medigap policies, which I hadn't heard about when I first enrolled. With Medicare. I've been on Medicare for a while. And I wondered what you could tell me about them, or how I can find out, how or where I can find out about them.
Well, Kathleen, first of all, thank you for calling back. I appreciate your persistence. That's wonderful. And Medigap is one of two popular choices that people make in choosing a Medicare plan. One lane is the Medicare Advantage lane. It's also called Part C. Medigap is also called Medicare Supplement. There's some overlaps, but they operate differently. Medigap is where you basically pay a flat premium every month, and it covers pretty much all of your expenses with rare exception. It's a higher premium, perhaps, than you're paying in a Medicare Advantage plan, but in Medicare Advantage, there's a lot of variables, and you're paying copays and coinsurance and things that accumulate to a higher maximum out of pocket that could end up being more money spent than necessary. So what I would recommend is please feel free to give me a call. I'd love to talk a little bit more about your particular situation. 651-303-8889, because I want to make sure that we're giving you the right answers that apply specifically to you. But I'm really glad that you asked the question, because there are other people listening today who have the exact same question, and Kathleen, you were brave enough to pick up the phone. So thank you for doing that. But feel free to call me today, tomorrow.
There was one more thing about it, and I don't know how true this is or whether it would, who this exactly applies to. But apparently the info was that you have to apply for Medigap 1 year after you're on Medicare, or else there could be difficulty getting a Medigap plan.
There are different time frames that are involved, and we'll go into those more details when we talk one-on-one. But you're in the neighborhood, but there's more explanation to that. But there are time frames.
It's a long explanation, huh?
It takes more than 30 seconds. Yes.
Yes.
Well,
okay, I will call back. Can I have that number one more time?
Yeah. 651-303-8889. Looking forward to speaking with you.
We'll do a full show on that, Harvey, coming up.
Yeah, sure.
All right. We hope you enjoyed today's show, folks. Please give us a call if you have any questions, 612-999-3426. Please join us again next Saturday at noon for another live broadcast. And thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, choose to live well.